What does an adequate disability exam consist of? And have you had an adequate disability exam? Lately, I've had so many comments from people telling me about inadequate disability exams that I thought it was necessary to do this video. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams. I've done over 1,500, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, this video is going to be a bit long because the subject of disability exams takes some time, and time is important. I've heard from multiple sources of people having exams that only took about 5 minutes. I can tell you that the shortest exam I've done was about 20 minutes in a younger, healthy person with only one problem, and the longest was about 40 minutes. I'm going to list all of the things that Social Security considers essential to be done in a disability exam, and you'll soon see there's no way they could all be done in 5 minutes. That being said, a couple of caveats. Number one, there's two sides to every complaint, and complaining about doctors seems to be a favorite national pastime. I've often said that Jesus Christ could come down off the cross and treat patients, and people would still find things to complain about. Also, there's no one way to do a disability exam. Every doctor has different ways of doing an exam, and that's fine. For example, in patients with neurological problems, I like to do the Hoffman reflex. Most doctors don't test that reflex, and in fact, probably the majority of doctors don't even know what that reflex is. And again, that's fine, to each their own. There are big, thick books written about the patient exam, and there are so many tests and reflexes and signs that it's impossible for anybody to know them all. I certainly do not. Another thing I see people complaining about frequently is that the doctor who examined them was not a specialist in the field where their problems lay. Folks, Social Security will not provide you with specialists for your problems. Some patients have 8 or 9 different problems and would require examination by 8 or 9 different specialists. You're going to get the doctor you get, and it's up to you to work as best you can with them. So let's jump into it and talk about the exam. A medical exam is divided into 2 basic parts. The first is called the history. That's where you talk and the doctor asks questions and gets information about your problems. The second part is called the physical exam. That's where the doctor looks and feels and tests your reflexes, etc. However, I recently watched a video by a disability attorney which illustrated the principle that you should get your health care advice from a doctor and your legal advice from an attorney. This attorney was making a big deal saying that disability doctors were sneaky and cheating because they were evaluating the patient by watching what they did and how they moved from the minute the person walked in the exam room. Well, of course the doctors are. Doctors do that for every patient they examine, whether it's a disability patient, a patient in the emergency room, a patient in the clinic, or a patient in the ICU. The doctor is observing the patient from the moment they lay eyes on them to the moment they can't see them anymore. That's what a doctor is supposed to do. By the time I've greeted the patient, they've come in the room and sat down in a chair, I've observed whether they can stand, walk, sit, hear, see, understand, and speak. For example, I recently had a patient who was confused He was brought in by his niece, and when I greeted him, it was obvious he thought he was in a dentist's office and he wanted me to take care of his sore tooth. So to get on with the exam, the first part of the history is called the chief complaint. These are the patient's main issues, and in a disability exam, these are the issues that are making the patient disabled. Social Security lists these on the exam form. The next part is called the history of present illness. This is the story behind the issues that are making the person disabled, and this takes a little time. Generally, we want to know when the problem, what is the problem, when did it begin, what has happened since it began, and how is the person doing now, and how does it limit their ability to work. One patient recently commented that they thought they'd talked too much during the history and wondered if that was a problem. Well, in my experience, it's more of a problem that patients won't talk enough, won't give me enough detail. But once in a while, I get a patient who's talking too much, and I just gently get them back on track. When it comes to talking too much, the main things I see are people talking about non-disabling problems like high blood pressure, or people spending too much time in the past. Like I recently had a patient whose problems had been ongoing for several years, and it seemed they wanted to talk to me about every single doctor's visit they'd had over those years, or patients who want to speculate about the future, how they might be if they see another specialist, or have another test, or have another operation. It's important to focus on the present. What Social Security wants to know are what problems you have now and how do they limit your ability to work now. The next essential thing is Social Security wants to know, are you right or left-handed? Then they want to know, what medications are you taking now? This is usually obtained by the medical assistant. Then they want a list of your other non-disabling medical problems. This is when you mention things like high blood pressure or high cholesterol, medical problems that are issues but aren't making you disabled. The next essential thing is the surgical history. They want a list of all the operations you've had from the time you were born up to the present. Next is the family history, which is essential. That's basically, do any conditions run in your family? And finally, essential is the social history. And the essential components are, how far did you go in school? Because the more schooling you have, the more job opportunities you have, according to Social Security. And also, do you smoke? Do you drink alcohol? And do you use recreational drugs? And a lot of people are worried about admitting that they use marijuana, and you need to know that Social Security doesn't care about marijuana use as long as you don't come to your disability exam stoned out of your mind on marijuana, which I've had 2 patients do. So that's the medical history. The next part of a disability exam is the physical exam. And the first part of the physical exam is done by the medical assistant. This includes a vision check. So if you wear glasses, please bring them to your exam. It also includes measuring your weight, your pulse rate, and your blood pressure. Now, when it comes to the doctor doing the exam, there are 2 types of checks. There's what's called a focus check. That's a detailed check, and I do that on whatever problems the patient has told me they have. The other check is called a screening check. That's a much briefer check of systems that the patient hasn't told the doctor there's a problem with, which you're checking just to make sure there's no obvious serious problems. For example, in a patient who tells me that their problem is pain in their back and their knees, I'm going to do a focused exam of their back and their knees. But I'm also going to listen to their heart just to make sure there's no abnormal heart sounds. Whereas in a patient who tells me they're disabled because of congestive heart failure, I'm going to do a detailed focused exam of the heart and circulation, but I'm still going to feel their back and see if they can bend forward and backwards as a screening exam for their back. Why do I do screening exams? Well, there's an old adage in medicine, if you don't look, you won't find. And when I do these screening checks, I find things routinely. For example, I find disabling conditions that the patient didn't mention in the history. The last day I did a day of disability exams, 3 patients were found to have disabling conditions that they hadn't mentioned. And I also find other conditions that are important, such as I found a patient who had early pneumonia at a disability exam, and it turned out they just thought they had a cold. So essential parts of the physical exam are the head, eyes, ears, nose, and throat, and each of these should be briefly checked even if there's no complaints about them. The neck, where the doctor will feel the spine in the neck and for enlarged lymph glands and thyroid gland. The chest and respiratory system, where the doctor should at least take a listen to the breathing. The cardiovascular system, where the doctor should at least take a listen to the heart. The abdomen, where the doctor should at least feel the abdomen. And then the main systems where most disabling conditions are found are the musculoskeletal system and the neurological system. Now again, these need to be divided into focused exams and screening exams. For example, if the patient says their problem is rheumatoid arthritis, then a detailed exam of the joints affected by rheumatoid arthritis needs to be done. Whereas if the patient says that their problem is multiple sclerosis, which is a disease of the nervous system, then a detailed exam of the nervous system needs to be done. Here are the essentials that have to be done no matter what the problem. Number 1, the patient needs to be checked for range of motion of their joints. Now, Social Security lists 102 different joint range of motions that need to be checked, and that's simply impossible. Just doing that alone would take over an hour. So I've come up with a screening exam that tests the joints pretty well and can be done in just a few minutes. I've made a video about it. However, if a patient complains of a specific joint having a problem, I'll do a more detailed range of motion test of that joint. The next is Social Security wants the strength checked in both arms and both legs and also grip strength. And Social Security wants to know if the patient can approximate, can touch their thumb and each finger of both hands, and can they make a full fist with both hands. They also want to know if the patient can do fine manipulation with both hands. And there's several different ways to check that. One is having a patient undo and then do up a button. Another is having a patient untie and then tie up their shoes. Then they want tendon reflexes tested. This is where the doctor uses a reflex hammer, and the reflexes should be checked in each arm and each leg. Finally, an essential component is what I call agility testing. Social Security wants the doctor to observe the patient standing and walking, and if they can, walking on their tiptoes, walking on their heels, walking heel to toe like a sobriety test, and squatting down and getting back up. Those are the essential components of a Social Security disability history and physical exam, and I hope it's clear by now that there's no way that all that can be done in 5 minutes. And I would ask you, if you're finding this helpful, to please give the video a like and consider subscribing. Finally, at the end of the exam, the Social Security asks the doctor for their impression, which is the doctor's diagnoses of what the patient has, and their abilities, which are what work-related abilities can the patient do without difficulty, and then their limitations, which are what work-related abilities does the patient have difficulty with, or can they not do at all. And finally, there's a place for recommendations. And here the doctor can recommend, for example, a psychological evaluation if the patient is having major psychological issues, and also some tests that Social Security can order and pay for if necessary, such as certain x-rays, heart stress tests if a person's having chest pain, or pulmonary function tests, which are lung tests of breathing if the patient's complaining of trouble breathing or shortness of breath. So that's a lot of information. I hope it's helpful, and as always, remember, if it happens, it's possible.